Good evening, ladies and gentlemen. Welcome to my new episode, Lifestyle with Dr. Mobi. This is Dr. Mobi, and today we have a special guest. But before we go into that, I would like to first say a few words. Just remember that lifestyle is, we have to make gradual changes. And we have to make changes which are realistic. You can take all your time, but make sure you are clear on the direction. The changes are not hard, so lifestyle only comes down to making gradual changes towards your healthy lifestyle, whether it's diet, sleep, or exercise. Now you can do one by one or any of them. There's no time frame, but it's very important that we are all clear that this is long-term solution. It is not 1 month, 1 day plan. It has to continue for rest of our life. So today I have a special guest for many reasons. And I always encourage everyone to come forward with their story, especially that made changes to their life. It's very important to hear from everybody. So let's welcome Dr. Rashid Chotani.
Hello,
Welcome you, Doctor.
How are you? Thank you for having me on the show.
Thank you. Dr. Chotani, I would like to introduce that he's an epidemiologist, doctor, professor at University of Nebraska, and currently working on COVID-19 project. He's really very well-renowned person, and he's a great friend of mine. So I'd like to give mic to him to introduce more of his accomplishments.
Well, my name is Dr. Rashid Chotani, and I am an infectious disease epidemiologist, a physician by training, multiple disciplines, but right now, one of the things that I'm working on and extremely focused on is COVID-19. Mm-hmm. But we are not here to discuss COVID-19. I could have another show on that. Mm-hmm. Today we are here to talk about the life changes that made it possible for me to be who I am today and healthier than I was before. Mm-hmm. And it goes back a few years. When we first met, I was already on a diet, and the reason that I got on that diet for myself was because my hemoglobin A1C, mm-hmm. Which diabetics have, mm-hmm. Got out of completely range, and it was dangerous. Mm-hmm. And I said to myself, I've got to do something about it. Mm-hmm. Thus, I started a diet that actually helped me reduce the weight. Mm-hmm. At the same time, reduce it to a point mm-hmm. that I could get off my medications, mm-hmm. diabetes medications.
Wonderful.
But what happened in the middle was that I met and had a discussion with you, and we talked about some of the things that you recommend in terms of the diet that you have put together and the program that you put together. And I took not all of it, what I had, I took what I was doing, mm-hmm. but I took some of the key things that you were talking about mm-hmm. in terms of disciplining myself. For example, what I ate for breakfast, mm-hmm. I modified that a little bit. Mm-hmm. Then, the lunch mm-hmm. and then the dinner, and what type of snacks specifically I could have in the middle. Mm-hmm. So those were the kind of things that I worked on. I mean, it was not an easy thing for anybody who's going to go on a diet. Mm-hmm. It's not going to be easy. No. But I can guarantee you that, after a little while, you kind of get used to it. But it takes a very long time to get used to it.
Mm. And that's a very important concept. And I always say that, our direction should be very clear. That where we want to go, we need to have clear understanding. And I think I just once again tell to follow the book, read it. But let's talk a little bit about basic principle. So where do you think was the change you had to make in your thinking that this is the direction you have to take? I'm sure you probably self-analyze yourself first, right?
Yes, I did. But when my hemoglobin A1C went to a point that it was in the dangerous red level, the only way to counter that was to start using insulin.
Yep.
And I said to myself, should I? Because I could control it, right?
Yeah.
It's not a problem.
Yeah.
I could take insulin, eat whatever I wanted to, mm-hmm. and still have everything under control. Mm-hmm. The other option was that I would not take insulin. Mm-hmm. I would modify my diet, modify my lifestyle, and then control it that way. And I thought that it was the easiest. I mean, that was the way that I wanted to go. Remember one thing, and you know it better than I do, and some of the people that are listening to us know it better than I do, that when you have diabetes, type 2 diabetes, you start out with something which is called metformin, and you might take 1 pill a day, then you might take 2 pills a day, then the dosage is increased, and once diabetes is not controlled, you add Genumet or something additional to it, and once it is not controlled by that, then you have to start using insulin. But that is the progression of the disease, because as humans, if we feel that everything is under control, then we are going to do whatever it is because we enjoy eating, and I enjoy eating. So we'll continue that lifestyle. But once we make a decision that we want to get off medications because that dosage is never going to decrease whatever you do, that is the point that you've got to say, okay, I've got to make a change for myself, for my family, because I really want to see them as long as I can live in a healthy way, not in a way that I'm unhealthy, and enjoy life with them. And that is the motivation, right? The motivation has to be for yourself, and then first for yourself, and then the consequence of that is that you will be able to enjoy life with your family for a much longer period of time in a healthier way.
And that is beautiful concept, that please change your lifestyle for yourself. Help yourself. If you're not healthy, what good is going to be? So also very important from Dr. Chotani's observation, first of all, he mentioned something that there are few status quo which we can do. So if we are diabetic, so for general population diabetes, we're talking about type 2 diabetes or mostly obesity related, or where there is insulin resistance, we're not talking about type 1. So that is just for educational purpose only. So for those, we have to realize that we can either take medication, and which we should, by the way. There's no excuse that we let the sugars go high. And I see a lot of patients, and they say, oh doctor, I can't take those pills. I understand completely that, being also, when I get sick, it's hard to take multiple pills, multiple times a day. And it's a difficult lifestyle. That's true, but remember, control your sugar, whether you control with medication, whether you take metformin or other medications. So first of all, identify and acknowledge that you have a problem or a disease. And then you're going to take care of steps effectively with your doctor. You're going to take medication to control it. Next step, along with, which I highly recommend, make a good change to your lifestyle based on your commitment to yourself and your family, because they are relying on you. And a lot of families, actually, it's important that they all participate in that. When I was doing my lifestyle change, my wife actually sacrificed her own diet, and she changed so it does not feel very different for me. But it also has to come same for everybody, that it's a family thing. We all need to do together and learn the principles. So if you take medication, that is one, but let's learn about his lifestyle change, which changes he made to his diet, especially, Dr. Chotani.
So one of the big changes that I had to make initially was that I had to decrease the number of carbs that I was taking. So I did not get away from all the carbs. I did take some, but in the morning, for example, in the breakfast, I followed what you had recommended, specifically to the T, and that was, but maybe with a different kind of 3 egg whites, in an omelet form, and I would not use any type of bread with it. I would put it, roll it up like a tortilla,
Yeah.
and that's what I would have, right?
Great.
And then in the afternoon, I would have a patty, whether it was beef, fish, chicken, veggie, whatever, with salad and one slice of bread, not two slices of bread. Or if it was a bun, one side would go away. I would have. So those were the little carbs that I was getting. And in dinner, the critical thing that I had to give up, and to be honest about it, I don't miss it anymore, was rice.
Yeah.
I gave up rice. I gave up. I still have a little bit of bread for dinner, but I do not have rice. Now, if I have this urge of having rice, I might have a little bit of it once a week. And that also, what I do is I would take something in a bowl, whatever I'm eating, chicken or something, or beef or something, and I would sprinkle rice on it and have it. Now, initially it was very difficult because the body demands you to have carbs.
Yeah. That's
And our system is designed that when we think about carbs, when we think about oily stuff, when we think about salt, our mouth will salivate. That's a natural response that we have. Even thinking about it does that to us. So
Yeah,
please
it's-
try it.
yeah.
I'm not kidding. Please
That
do
is
try
so
that.
true. That's so true. And he's telling me, and I'm salivating.
Yeah, see that what happens. So what you got to do then is you've got to control yourself and self-discipline yourself.
That's
Now, people, your friends will go, "Come on, have some," and you have to say, "Listen, I'm on a diet. I can't do it. I'm diabetic, so I cannot have this type of food. So I have to accept the fact and not be ashamed of that disease and talk about it, right?"
That's true.
But what happens when you do that? What happens is when you stop eating the kind of bulky food that you were eating, is that your stomach shrinks.
That's true.
Once it starts shrinking, your urge for having more food declines tremendously. And how does the body compensate for it, right? And you've explained it in your book and all that. So we already have a ton of stuff inside our body that is in the form of fat that is accumulated over the years. So when when the body needs the energy, it starts draining that fat out. So it's a natural process, right? You've not taken any medications, you're not taking any supplements. What you're doing is you're controlling your body, and then what you're doing is you're making your body get rid of the fat itself. But this is not a drastic thing that you will see in a week, a month. This is not what you see when, what you hear on television, some people selling, right?
Yeah.
This is self-discipline. So it will take, and I can assure you, if you follow this diet, right, the kind of stuff that you've recommended, the kind of stuff that I've done, in about 3 months, people will come to you and go, "Oh my God, what happened? You lost a lot of weight." Because initially it really doesn't show. But all of a sudden, after 3 months, beyond that, it starts showing on your body, and you look slimmer.
Yeah.
And that is the beauty of this thing, that is done naturally without anybody using any chemicals in your body.
And that is very, very, I think, important to realize that few things which he pointed out, and I love it. First is mindful eating. So make sure we again re-emphasize that centers, whether it's a hunger center, reward center, satiety center, is in the brain. Stomach is only a bag, and it is a muscular bag. If we stretch it, it gets bigger. If you put food which stays there longer, fatty food especially, it's gonna actually ask more food next time. So if make sure you drink plenty of water. So you want to drink water before you eat. So that differentiates. Many times people are actually thirsty and they feel they are hungry. So drink plenty of water. Second thing is you want to eat and stop eating when you know you have a little bit appetite left, because what will happen is that if you keep on eating, yes, ultimately you have to stop, but if you do it in a very disciplined way, it's better for you, your body. Imagine that you are giving your body to absorb huge amount of food, whether it's carb, protein, or whatever, and you're telling your body do it. How it's going to do? Remember, it's going to do by providing blood flow, and blood flow is limited, which means that it can only provide certain blood flow to the organs at the expense of other organs, which are heart and brain and so forth. So remember, if we eat smaller portions and appropriate portions, then we really actually help our body. So eat multiple times a day and drink plenty of fluids. Do not overeat at one time, because that's very hard on the body. Just help your body, and that's very important. And once again, to Dr. Chotani, very good, congratulations.
Thank you.
And I'm so happy for you that you are looking great as always.
Thank you.
but
Thank you.
I'm very happy that you are taking care of your body and health, especially for diabetes. Now, for other people to understand, we'll just re-emphasize a little bit on hemoglobin A1C and your sugars. So just explain a little bit about that for the audience.
Okay, so for diabetics, what we are supposed to do is that we have to test our blood glucose a couple times a day to see how it's being managed. If there's a certain limits, there are normal limits if we are exceeding those normal limits. And we've got to record that, and then we've got to go to our primary care provider and tell them this is what is happening, and they will adjust the dose of our medication. One very strong indicator of your health for people who are diabetics is hemoglobin A1C. What this does, it tells you if it is under a certain level that you're not at risk anymore, and you don't need the diabetes medication. But for diabetics, if it's other comorbidities, other diseases, sometimes it's better to take just a little bit of metformin than not take it. But it tells you that, listen, you don't need the disease, but at a certain level, it tells you that you got to have 500 milligrams of something, or 1,000 milligrams of something, or 2,000 milligrams of something. And at that certain level, it tells you that, listen, just metformin is not going to help. So what you've got to do is you've got to add something to it. And then when it gets to about 10, it's a pretty, the number gets to about 10, the value gets to about 10, it is pretty dangerous. And what you got to do is you got to start using insulin or something like that. You really don't want to get there. So use the diet, smaller portions, and exercise. Those are the three components that are not only going to help you if you're diabetic, but at the same time, they will make you healthy, irrespective of whether you're diabetic or not. Because what you're doing is you're taking care of your body now, and you're making your body stronger by exercising. You're making your body leaner, less fat, so your cholesterol level goes down, so your heart disease risk factors go down, if including all of those things, one of the other things that I did was I made sure that my salt intake was decreased. And guess what? After a little while, I got used to eating food with less salt than what I used to eat with, because my mouth got used to it, my tongue got used to it. I got used to having less sweetener or anything in my drinks. One thing that I would tell you that is important, it's paramount, is to stop drinking sodas. Just avoid that. Irrespective of whether it's diet or non-diet, do not drink it, because the content of sugar in the regular sodas is so high that it's incredible. And then there's so many chemicals in the diet soda that you really don't want to have it. Now, if sometimes people come and ask me, so is it okay to eat a muffin, or if I compare a muffin to a bagel, which is better? Guess what? Muffin has less sugar than bagel. I don't eat either of them, but if you want to make a choice, and Dr. Faisal can talk more about it, you have to make some smart choices over here.
True.
Because there are things like donuts, which are we've been eating all our life, or muffins or bagels. What is it that you need to eat? If you want to eat bread, which is toasted, is it better if you really want to eat it? So I'll give it to you to talk a little bit about that.
Yeah, and I think it's very important. I think I talk a little bit in my book also, and I want to actually emphasize that. First of all, what has happened is the industrialization and fast food industry has actually compacted the calories into what I call calorie bombs. So all of a sudden, donuts have like 600-700 calories in a little bit piece of donut. And guess what? We take that 1, 2, 3, and we think, oh, I'm not eating much. Many patients come to me and my friends also, and they say, by the way, we only ate 2 or 3 donuts. What? 2 or 3 donuts? Did you look at the calories? Those means that you already ate 2000 calories. I'm so sorry. So then what are you going to eat all day? So, and that unfortunately, people don't realize the calories on those, whether it's sweets, chocolate, or whether it's donut, or whether it's a pizza. So another problem with the fast food is that people try to eat that very quickly without realizing that they are actually taking 1000 calories in 5 minutes or 10 minutes. So take your time to eat and give your body, enjoy the food. You don't eat food because you have to finish in 5 minutes and work, which we all do, by the way. But make sure you pay attention what you are eating. Drink plenty of water. And the other thing is, like he has mentioned very much about A1C, make sure follow with your doctor, make sure work on that and keep that under control. Whether diet is definitely going to play such an important role in that, but it's very important to work with your doctor and keep working on that. We all have to work on it to defeat this diabetes epidemic right now, and it can really complicate a lot of factors. The other thing which I would like to also emphasize to my audience, that there are certain populations which are very high risk, namely African Americans and Asians. Now our BMI is actually, all the studies were done using white population, and their BMI is little different. So for 25 BMI, which is obesity cut line, for Asians, especially me, it will be actually still very obese even on 24, in my opinion. So pay attention to your own body. Look at the numbers of your numbers. Do not go by just one. So if your A1C is high and then your BMI is still a little bit low, maybe your genetic makeup is geared towards that. So make sure pay attention to your own labs and work with your doctor. Do not go by just numbers. Look at your own body and then help your body in making great decisions. Other thing Dr. Chotani mentioned, and it's so important, walk 30 minutes or more every day. Walk. You don't have to run. You do exercise throughout the day. You don't have to do at all at one time. Walk every day. Make sure you use certain app or something to track your steps. And that is the key, that do gradual, do things which you can sustain rest of your life. You do not need to join membership of a big gym or buy an expensive treadmill. So because those, I did it by the way too. I bought it and my wife was very upset with that because I keep on buying things and never lost weight. But then I figured out what the problem was, not to get another fancy gym, but actually pay attention to your own steps and exercise program. So pay attention, and then I'll also talk a little bit to Dr. Chotani on sleep. So did you have to help your sleep in a way?
Yes, I will talk about the sleep, but before that, please tell the audience that if they eat, 3 donuts and perhaps get about 1,000 calories, how long does it take to burn those calories if you were running?
Yeah, and that is very, very important. So usually I tell, remember, to burn 100 calories, give and take, is you have to run 1 mile. So 1 mile takes long to do every day. So remember, so if a donut has 400-500 calories, you need 5 miles. And so to burn that donut, so just rough, this is rough. I mean, of course, it depends on how fast you run and so forth. So if you say, oh, you're gonna burn that 3 donuts by running a marathon of 15 miles, I don't know, you can do that every day. So try not to eat as much. So that would be my advice, simple advice on that. Thank you for bringing that.
And about the sleep, right? So one of the most important thing that happened, right, after losing that weight was that my wife was very happy because I was no longer snoring.
Oh, great.
And it was a surprise to me also as to how much I used to snore. And my poor wife had to live with my snoring for almost 24 years.
Oh.
And then after that, now, it is pretty good. So my sleep got better. I was not snoring. My deep sleep got better because of this. So I think the weight loss, losing weight, is not only affecting you while you're awake. Actually, it is a positive thing, because when you're asleep, if you're fat, there's so many things that are not going in your direction. So in the positive direction. So losing weight is day and night, 24 hours, helping your body to move forward better.
Okay, well, thank you for sharing that. So just one more thing is that a few final tips would be: make sure you sleep well, and you want to get adequate hours. The quality of sleep depends on also, if you have sleep apnea, to make sure sleep doctor be consulted and then get proper evaluation. And if you work on weight, it is very weight sensitive. You really don't need to lose 100 pounds. Actually, you can lose few pounds, and that will fix your sleep apnea much better. So remember, that happens because our airway, fat deposits everywhere in the body, including our airway, and that gets narrow, and then that causes all the sleep apnea problem. So concentrate on basic life healthy principles, get adequate sleep, focus on your nutrition during day, walk every day, and that's gonna really keep you very healthy and stay away from a lot of other problems, health related. So with that, I will ask for final thought from Dr. Chotani. Thank you once again for coming.
Thank you very much. My final thought would be: lose weight, be healthy, get a good night's sleep, and you will not only make yourself happy, but you will make your spouse happy, and will be there to enjoy your family for a much healthier, longer time. Thank you very much, sir.
And thank you once again. And don't forget to give us feedback on Twitter, podcast, and also email and our website. You have that below. So good night. Thank you.